joining us at the Dementia Resource Expo. Today, our speaker will discuss the importance of having advanced care directives for you and your loved ones. My name is Renee Horn, and I'm a caregiver support coach with Elder Options and part of the Dementia Cure and Care Initiative Task Force. During the session, I encourage you to post your questions and comments in the chat feature. Keep an eye out for the response in your chat box. I want to welcome DJ Ryan, who is the Community Education Liaison for Hospice of Marion County. Thank you for joining us today.
Thank you, Renee, and thank you for taking time out of your day to spend it here with the Dementia Resource Expo. Today we're going to focus on the importance of having advanced care directives in place for if and when we encounter an event in which we have to make medical decisions for our loved ones. Nobody ever plans for this day, nobody wants this day to ever happen, but unfortunately it's part of life and this day will occur sometime throughout our lives. For me, it was when I was 26 years old and my 59-year-old father had a massive heart attack. He did not have advanced care directives in place. He was on life support for 5 days, and my brothers and my sisters and my mom spent 5 days in anguish and frustration of trying to figure out what's going on with him and what his wishes were. Eventually, we withdrew life support. 10 years later, I became a nurse, and then fortunately after that, I've been a hospice nurse for going on 20 years now. My family circumstances were abrupt and unexpected. However, for those living with dementia and Alzheimer's, it is often very slow and gradual. There are times it's very rapid, but usually slow and gradual. So now is the time to explore and discuss what your loved one wants for themselves. When that time comes. Unfortunately, the reality of Alzheimer's and dementia is that it is fatal and that time will come eventually. By having advanced care directives in place, this relieves a lot of stress, a lot of guilt, a lot of frustration, and makes that transition much easier. For the moment, I'm going to switch to my slide presentation. Again, DJ Ryan, Hospice American, registered nurse. So Hospice Marion County, we are a nonprofit here in the Hospice in Marion County. We've been established since 1983, and we have multiple modalities and services available here throughout the Marion County. We're going to understand terminology, discuss some of the challenges, and do an overview or overall view. And why have these advanced care directives? They provide the written statement for your wishes, for your loved one's wishes, regarding their choices in end-of-life care. This will be a tool to help think through the communication aspect. And it's also the roadmap that your loved one will have when you become unable to speak for yourself or you have to speak on their behalf. A lot of people are confused about what advanced care directives are. Again, I've worked with families for the past 20 years. Sometimes they have all the proper documentation. They have healthcare surrogacy. They have power of attorneys, and they don't understand a lot of times what they have with them. And then because there are many variations of the advanced care directives, and they do cover so many things, the overall advanced care directives should include a living will, a medical, healthcare power of attorney, or healthcare surrogate or healthcare proxy. And they should be written out so in details. And again, we'll talk a little more about that. You're going to hear this term a lot. This is kind of a medical power of attorney. It's been used for so many different names: healthcare proxy, healthcare surrogate, durable power of attorney for healthcare. This is the person that decides to only speak when you're unable to speak for yourself. They're going to speak on your behalf for medical decision making only. It's kind of like the backup driver of your healthcare. And this can come in and out of play throughout the entire continuum of health. So there'll be at times where the individual's unable to make their decisions for them. So the person you pick steps up, makes the decisions. And once you regain capacity to make your decisions again, that medical healthcare proxy is set aside. The advantage of having your advanced care directives. You are in charge of making your own decisions, and for your loved ones, the documents can be changed at any time. Often people think that once you write 10 years ago, you write a healthcare proxy, things change, life changes, people come in and out of your lives. So these documents can be modified and changed at any time. They do not require an attorney. They do often require witnesses. They actually all require some sort of witnesses. And there are no charge for these forms. You can actually get these off the internet. A lot of times people are confused on terminology, when it comes to these end-of-life care decision-making decisions. So life-sustaining treatment versus artificial nutrition and hydration, tube feeding, CPR, DNR. The challenge with that is if you don't put this down in your advanced care directives, again, I see this so many times the last several decades, is somebody will want tube feedings, but they don't want CPR. Somebody will want chemotherapy and ongoing treatment, but they don't want they want to be a DNR, but they don't want any future hydration. So having these terms written out will save a lot of frustration, a lot of grief, and be very, very definitive on what you want for yourself and for your loved ones. Options at end of life. Obviously, the obvious one is continue treatment and move forward with all aggressive therapies and modalities. The other option is continue with treatment and also have pain and symptom management on board. That's often through the palliative care team, or stop aggressive measures altogether. That doesn't necessarily mean stop treatment. There's a misnomer about that people think once you stop aggressive treatment, you withdraw all medications, you withdraw all support, you withdraw all treatment plans completely. So that's not the case anymore. Years and years and years ago it was. But some people choose to stop the aggressive treatments, but still continue with the routine medications, the routine treatments, just no longer want aggressive treatments. Often people confuse this. This is a medical term that is often, there was synonymous, 10, 15, 20 years ago with hospice palliative care. This is a relief of distressing symptoms, and people can actually continue with their aggressive therapies while they're in palliative care. Now here it's called palliative supportive care here in Hospice Marion County. The misnomer is that people come on palliative care, they stop all aggressive treatments, they stop all therapies and so forth. That's not the case anymore. That's actually under hospice care, not necessarily under palliative care. Again, for those that decide to stop all aggressive therapies and they decide to stop all aggressive modalities and withdraw all life prolonging measures, that's when hospice care would come into play versus palliative care. Again, under hospice care, we do continue routine treatments for most disease processes. We do focus on comfort management, symptom management, and quality of life necessarily over quantity of life. So some of the advanced care directives, they can be very lengthy, they can be very complicated, or they can be very simple. Some of the options we have here in Central Florida are 5 wishes, which is often, which is available here at Hospice of Marion County. It's a more simple process. Some of the other organizations here that are available, Honoring Choices here in Florida. This is a state one. This can be even more complicated, more in-depth, more detailed, and that information can be received off the email provided under honoringchoicesflorida.com. Another advanced care directive that we focus on here is called the Conversation Starter Kit. This is one that really, really helps folks who don't know where to go, don't know what to do, don't know how to start this process, and how to bring it up, how to discuss it. This one is a lot more, this is a booklet that's a lot more detailed. I'm going to stop sharing here and take a quick peek at those booklets with you guys together. So the 5 wishes, this is a very simple one, has a living will. A lot of times people will think that I have a living will, therefore I do not need a DNR, because on this form it does say you do have the option to choose. I do not want life support, I do not want intubation, I do not want resuscitation. However, this is not a DNR. This is not the same as a do not resuscitate order. So that one's list your 5 wishes of what you want your quality of life to be, how you want to be treated, and what you want your loved ones to know. Excuse me. The other one is called Honoring Choices in Florida. This is a little more detailed one. It's kind of like getting the process started and also giving you guidance on what questions to ask, what documentation you really need in order to make these documentations legal. This is an example of what they call a healthcare directive. This is strictly for healthcare decision-making only. And you'll notice that there are two lines there. One is always an initial healthcare decision maker, and you always want a backup proxy. So there's a designation of two healthcare surrogates. One is, again, your primary, and one is your secondary. Because as life changes, if your primary healthcare surrogate is with you in an accident, and they can't make those decisions, or something abruptly happens to them, you always want to have a backup. And again, on this particular one on Florida Choices, or Honoring Choices, it does talk about tube feedings, CPR specifically, ventilations, and so forth. Again, these are not the same as do not resuscitate orders. The conversation starter kit, this is a much more, this is really good one for Alzheimer's dementia caregivers and loved ones, because it does address when to start having the conversation. So early onset Alzheimer's, early onset dementia, early onset of mild cognitive impairment. And it really gives you a lot of guidance and choices on how to phrase it, how to word it, how to set it up. And one of the things that the Conversation Project really pushes, or encourages, I should say, is in steps. Do it in steps. It's a lot to take in, especially when you get a recent diagnosis of mild cognitive impairment or altered mental status or early onset dementia or early onset Alzheimer's. Loved ones that actually have the capacity to make those decisions while they're able to. Some of the challenges we discover is in early onset dementia and Alzheimer's is people know they're losing their memory recall. They know they're having some sort of mental cognitive impairment. And more often than not, they don't want to admit it. They don't want to discuss it. They want to have a conversation about it, because that means you have to have some level of acceptance when you have that conversations. So when you run into these hurdles, these obstacles, these challenges of having this conversation with your loved one, the Conversation Starter Kit's a great program, a great project to give you that guidance. And again, early on, better than later, because what we discover a lot is they talk about it, they don't put it in writing, they never designate anybody to do it. Sometimes they'll talk to one child about it, or their spouse about it, or their sibling, but they won't tell their spouse, their sibling, or the other family members, and can create a lot of conflict. I see this a lot in ICU, intensive care units, and where a family member will come up and say, well, Dad said this, he didn't want this, and the spouse will say, well, never told me that. And it can prevent a lot of complications there, and a lot of anguish for people making those decisions. I'm gonna pop back over here to our slide presentation, pick it up from there. Again, these documents are available at these websites. This is available at Hospice of Marion County, Five Wishes, and again, honoringchoicesflorida.com and theconversationproject.com. And there are multiple other advanced directives out there. What I don't recommend is typing in Google Advanced Directives State of Florida, because you'll probably have 15 to 20 different forms that you can choose from. So it can be very overwhelming. You don't know which one to pick, which one to choose. These are good three really good ones to consider starting with. Again, having this discussion, why have it? Again, it relieves a lot of stress. It allows the loved ones and the patients themselves to get prepared for what we know is eventually coming down the road. It also helps with finances and living arrangements, and again, involves the family, involves the patient. Some of the challenges that we've come across, especially in early onset dementia, mild cognitive impairment, is he doesn't want anybody to know about it, therefore he doesn't want to talk about it. Still want to see his friends, but then he gets embarrassed that he can't remember their names. And these are quotes that come from patients and families in the Conversation Kit. One is the medical physician not necessarily telling the patient that they have early onset Alzheimer's or early onset dementia, mild cognitive impairment, but they'll tell the spouse. And then it's on the responsibility of the spouse to kind of share with the loved one, which is really not where it should be. It should come from our medical physicians. It should come from our medical advisors, our primary caregivers and or neurologists. Yeah, and of course, this is a very, very, very common one. There's nothing wrong with me. They get very defensive and don't want to ever bring it up again. And then by the time they get to the point of wanting to maybe discuss it, their cognitive impairment's just not there, and they're not capable of making those decisions, or not deemed competent to make those decisions. Best time to have the conversation is early on, at the first sign of health decline. What if illness is too advanced? This is where you get a lot of times where the families can come together. So if the individual is deemed incapable of making their own informed decisions, then it's up to the Florida proxy law requires spouses first in line, then children, and then siblings of the spouse or siblings of the patient, and then parents of the patient. So again, it involves a lot of family members getting together. You can actually do an advanced care directive as a family if the patient or the loved one is deemed incapacitated to make informed decisions. And again, if that capacity comes around, then it's no longer valid. A lot of times, not knowing how to have the conversation is the biggest challenge. You don't necessarily want to bring it up over pasta and say, so what do you want to do when you drop dead? These are not conversations you want to have in that format. So it's, again, bring it up early. And it can be a very casual conversation. I actually had this conversation with my mom last month, my 83-year-old mother. So we are, fortunately for that, we actually now have healthcare proxy, healthcare surrogate, living will, advanced care directives, and a DNR for my mom right now, who just moved here to Florida with me as well. As soon as she got there, that's the first thing we made sure we had, because she knows what we went through with my dad. So again, have everybody who's going to be involved in the conversation present when you have these conversations. A lot of times it's not the spouse. A lot of times it's not your significant other. A lot of times it's deferred to the children because that's what the patient wants. My wife made it very clear she does not want to be the decision maker in my healthcare directives, so I chose two of my brothers and my mom, if she's still with us when that time comes. So don't assume that the spouse is going to be the one that's going to make those decisions or already has all those answers. Again, keeping it simple, share with what you want for yourself, and it's a two-way conversation because you also want your loved one to know what you want in the event that you become incapacitated to make those decisions. So it's not just necessarily having healthcare directives for your loved one with dementia or Alzheimer's. You'll want one in place for yourself as well. And a lot of times you can use that as a tool early on to say, hey, this is what I want for me. What do you want for you? Instead of coming at them, what do you want for you? And we'll not even worry about me. So that's one of the obstacles to get around of having that conversation, is have it together. Have the talk. There are, again, lots of fun conversations, lots of information out there available for this. One of the things that people don't like to discuss is making funeral arrangements in the advanced care directives. Again, I've seen this a lot over the last couple of decades. I'd be in the hospital and they go, what do we do when they die? They haven't made any arrangements whatsoever. So if you have an idea what funeral home you're going to use, what your arrangements, cremation, burial, whatever, add that into your advanced care directives. It'll make it so much easier for family and for loved ones. Keep the conversation going. Once you get these advanced care directives all solidified, witnessed, documented, you'll want to have a copy sent to your primary caregiver. You'll want a copy sent to your neurologist or cardiologist, your PCPs, your specialties. And more importantly, you want them a copy for your family members. You'll want one for anybody who's going to be involved in those decision making should each have a copy of that. That's the primary, the secondary, and tertiary, or the third healthcare proxy. All should have a copy of it. What you don't want to do them is put them in a safe deposit box. Unfortunately, what happens is these living wills, these healthcare directives, these last will and testaments, they're all locked in a box. And if you hadn't filled out the proper paperwork to say, I have access to my father's or my mother's or my loved ones' account, if you're not on that account, you will not get that information until you show up with a death certificate. So again, have these copies available for everybody. The beauty of advanced care directives is you get to know what your loved ones want. You get to voice your own decisions when you make yours. They get to make their decisions making theirs. Learn about your options, your choices, engage others to complete their advanced care directives. Because remember, it's never too early until it's too late. And then I'm going to stop sharing here and we'll talk a little bit more here. So I know there's a lot to take in a short time. Some of the questions that I didn't talk much about is the confusion between a living will, advanced care directive, and a do not resuscitate order or whatever. So a lot of times you'll notice on some of these forms, it'll say, this is a good one. It'll say no CPR, no IV fluids, what I want and what I don't want. So this is not a legal binding document. That's the challenge. A lot of people think this is legal and binding. At any time, the designated healthcare surrogate that you chose for you can override any of these decisions that you have chosen. The goal is, of course, choose a healthcare surrogate that's willing to honor your decisions, no matter how challenging or how difficult that can be. That's why a lot of times they won't choose a spouse. They'll choose a friend even. I've had a couple this year that chose their neighbor because they knew that their neighbor would honor their wishes. So this is not a legal document. This is a verbal binding document that is often witnessed by two individuals, one of them not being the healthcare surrogate and one not being a family member. So you can choose an attorney, you can choose a friend, you can choose a stranger off the street to be your second witness if you like. But keep in mind, these are fluid, these are flexible, and they can change at any time. We didn't talk a little bit about a DNR. Do I have time to talk about a DNR, Renee? Okay, thanks. So the do not resuscitate, or the DNR, this is a form that here in the state of Florida requires, in the event that your heart stops beating, you do not want to be resuscitated. Often a lot of people think a DNR means do not treat. It just means do not resuscitate. So just because you're a DNR, I'm actually a DNR. I have a yellow DNR at home and I'm only in my mid-50s and my wife doesn't understand that. But that's my wishes. So in the event that I drop dead of a heart attack, like my father did, I don't want my family to go through the anguish that we went through. So the DNR is a legal document, must be signed by a physician, must be signed by the patient themselves, and or must be signed by the healthcare surrogate proxy. So that's the one time where, even though it's not a legal binding document, if you're chosen as a healthcare surrogate or healthcare proxy, you are the one that's required to sign the yellow DNR at the hospitals and so forth. You can designate that to somebody if you are not present or you do not wish to sign that DNR. You can actually legally designate somebody to sign those DNRs on your behalf, as long as you have another witness from the hospital or two medical witnesses, people witnessing that decision or deferment. Again, the DNR needs to go with you. It needs to be with your person. Because I don't carry my little yellow one in my wallet, if I drop dead today, they're going to call 911 and ship me off to the hospital. So my wife knows my wishes, but unfortunately, you should carry the wallet-sized DNR with you in your purse or in your wallet. I think that's it. And then again, if you have any questions regarding for me, we can continue to answer those as well. How are we doing on time, Renee?
We're doing good. If you want to send it back to me on the post.
Will do. All right. Again, thank you for your time and feel free to ask any questions as we go.
Yeah, thanks so much for sharing with us today. I like the idea of having a conversation. Just last year, I updated my documents and I thought it would be simply just checking boxes. But I realized that even some of the choices, I needed to have a conversation with myself and a conversation with some of the people who might be making these decisions for me, if I can't. So it's good to have that conversation. So remind me again, when do these come into play?
Okay, so the healthcare surrogate, healthcare medical proxy, the healthcare medical power of attorney, they only come into play when the individual is deemed incompetent to make their own decisions. Unfortunately, again, 20 years of doing this, I've seen so many people show up, the patient's alert and oriented time 3, but they're currently sedated or they're currently in a non-responsive state because of medication inducement. They'll come up and say, hey, I'm a healthcare surrogate. I don't want you to give me any more IV fluids. I want you to stop all aggressive treatment. Yet, however, the patient wakes up and says, well, no, I think I want to try this and this and this. So a lot of times people think that the healthcare surrogate trumps the individual, that their loved one or that is assigned as their healthcare surrogate. It only comes into play as they're deemed incompetent. And people come in and out of competency all the time. Not necessarily so much with dementia and Alzheimer's because the disease progression is ongoing and gradual. Yeah. But again, for other services or other circumstances. But once a patient's been deemed incapable of making that decision by a medical professional, that's when the healthcare surrogate comes into play.
Okay. And these documents that you showed us, the honoring choices, you can get that online. Let's see, the 3 wishes, the 5 wishes.
5 wishes, yeah. That can be obtained online or here at Hospice of Marion County. You're welcome to come by and pick a copy up. Okay. And the conversation starter kit.
Yeah. And I love your advice about not just kind of doing a general Google because you're going to get overwhelming amount of information. You know, going to some of these documents you've talked about, go specifically to get those documents. Yeah. So I appreciate that.
And there's another thing that I run into a lot is because if you do the simple version or the simplest version and you just check, and you got 4 boxes, no CPR, no nutrition, no ventilation, and no tube feeding, it doesn't take in consideration how long you want to be treated with IV antibiotics. Some people want to be ventilated for 14 days. Some people want to be ventilated for 30 days. Some people want to be off the vent for 14 days before you stop all the other aggressive treatment. So let's put a feeding tube in, let's put a trach in, let's put all these aggressive measures in and just give it time, give it a try, give it a go. If you don't have it documented in your forms, again, your healthcare surrogate can trump everything you put down there. So it's not uncommon for me to come into a case where the patient in stage COPD had a massive heart attack, had a stroke. This is the common one. They had a massive stroke, and the doc says, you know, there's very little chance that an individual would make it through this. And they say, okay, let's give it 2 weeks, 3 weeks, 4 weeks, 5 weeks. So.
Okay. This has been really, really good information. I really appreciate it. If you asked a question in the chat box, I encourage you to look back in the chat box to look for that response. And I want to thank you for being with us today, DJ, and thanks to Marion Hospice for being a sponsor of the Dementia Resource Expo. And
thank you for having us.
Yeah, thank you so much.
Appreciate it. Thank you.
Right.